Very important, yes, very important. Everything I know about the budget, he told me. So
Ambassador, can I introduce you to the founder of the translation?
Congratulations. My pleasure to come here. Thank you for receiving us.
I've been asked by Shlomo to open the meeting, and obviously the epitome, the climax of this meeting will be to hear the ambassador's words about the hospital and the impressions thus far. But as we are sitting here in a broader forum, I think it would be first prudent if each of the people here will introduce himself, will explain his responsibility and position in the hospital, and maybe say a few words how he sees this hospital being different to previous positions in other hospitals. What is the unique point about the hospital? If you agree, we will start to do this. Is that okay?
Please.
With you? Okay. So we will start with Dr. Rothschild, the founder of this magnificent enterprise hospital, to greet us and to tell us a few words.
Honorable guests, it's a big honor and pleasure. It's a precious time to see. I'm from Switzerland, from Zurich, and I moved here to Israel, and I was in the city. It had about 120,000 inhabitants, even in any hospital. So I was very busy, especially on Sabbath and other days. And we found out you need a hospital to save lives. So the big rabbis and personalities told me, Dr. Rothschild, you have to build a hospital. So out of the 120,000, 190,000, 190, Dr. Rothschild, you are crazy. But they were right, I was crazy. But even I was crazy, we built this hospital, and it was a very big success. Now, everyone's asking me, why do you need a hospital? You have a top hospital, you have a very good hospital, you have your Telashomer, you have Johnson, you know this. You have a lot of top hospital, why do you need another hospital? And they fought against us, against me, but soon they said, we have specialties. We are not the big, the better hospitals that we are, a good hospital, but are better ones. But they found out the human part, that the estimation and the value of life, this was our special part. And at the beginning, they fought against us, but they soon found if an old man is coming, 90 years old. So he said, grandfather, when you want, go home, you take a bed of it, and we just made the contrary with our fathers and our mothers. And we made a special effort, and it was a big success. That we have a lot of old people that are coming, giving up, but they're walking out. But you should be aware, this hospital is really an English hospital. Why? Because there was a man, certainly no one heard him, was Mr. Freshwater. He was a rich man in London. And there were a lot of discussions about dissection after death and so on. So a lot of discussion. So he said, why you discuss? Do something, solve something. So he gave me the first million. Then it was quite like the first million, and we started. And we had a lot of miracles, I think, that the hospital came out. And we had already in the first months 280 births a month. Today we have 40 births a day. In England we have 700,000 births a year, so you have about here about 15% what you have in this country, I mean, what you have in England, so we have here 40 births a day. And there's a lot of things you can learn from England. I wanted to give a new name to the street to come to the hospital. What name I wanted to give Harley Street. The permission, so you see, it's like at the hospital, we had to say the hospital. And so we learned a lot. You have the health system. And like everything, there are a lot of positive things, a lot of negative things. And I want just to tell all my friends here, my people, are you aware in England a lady is going home after 8 hours after the birth. But there is a whole organization of midwives, social workers, where they save a lot of money. We are given them 3 days because they are our guests, and it's very important for us to have them. But there's a lot of the English health system. There are a lot of things that are very good, a lot of things they gave up and they changed. And we learned a lot of them. So we are an English hospital, and we have the top representative from England, so we are very, very honored. And we are still learning. Somebody is also able to learning from us. But the main goal here should be it's life. And that's our specialty. And that's why there is no more battles. Every hospital, Professor Shanley, who is the head of Telashana Hospital, is here in our committee. They are helping us. We are working together. And together we are working to find life. So we started with life, prematures, births, and also old age. And it's a pleasure. And we are learning from England. And maybe we can learn something also for us. Thank you for coming. All the best.
Thank you. May I please ask Rabbi Hofner, the rabbi of the hospital, to tell us how he finds from his angle the hospital.
Okay, I want to continue what Dr. Rothschild actually said, because he's the founder, and I'm responsible to actually to implement his way of doing things. This hospital is not only catering to observant Jews. It's also being ruled by halacha or law. I just want to say a few examples. Dr. Rothschild mentioned them briefly, but that's really the essence of the hospital. The sanctity of life, which is actually the real reason why this hospital was created. We can start in the beginning of life, we can start at the end of life. Every fetus, as soon as he was created, he has a right to live. He has a right to live, and we won't kill him even if he's missing a limb, or if he's Down syndrome or something like that. We'll never kill him, only if he's endangering his mother's life. If he endangers his mother's life, then according to the Jewish law, you can make an abortion. Otherwise, you're not going to make an abortion. And that we strictly adhere over here, only abortions which are according to the Jewish law do we do over here. If somebody wants to do it otherwise, tell them we can't do it over here. I'm sorry, you have to go to the Divine Hospital. We'll do whatever you want. Also, the Jewish law says that if somebody is terminally ill and is in the last hours, he's called a goses. It means terminally ill, and we're not going to move him. If we move him, it's like killing him. It's called, if somebody moves somebody like that, according to the Jewish law, it's called a murderer. Therefore, if we have our nurses over here know that if there's somebody terminally ill and he's going out, they must not move him. It's the only place that I know which is very, very adherent to these laws. Also, people calling up the whole time from all over the places, according to the Jewish law, even if somebody is terminally ill and he has no hope, every minute of his life is important. Every minute of his life. Therefore, that is actually the main reason, and we saved lives according to the Jewish law. We saved thousands and thousands of lives since this hospital was founded 25 years ago by Dr. Rothschild. The atmosphere of the hospital also has to say, if you come to here on Shabbat, you feel completely different. You feel a higher atmosphere. We have some nurses, doctors living which aren't observant, and they live in the kibbutz. One of them told me, I come over here to work on Shabbat, especially, particularly on Shabbat, because I like the atmosphere over here. I feel a lifted atmosphere. That was actually the reason that this hospital was founded, and that's the way it's done. Those are the main the main aspects of the spiritual life of this hospital. I hope you enjoyed over here, and you enhance your vision of the Orthodox community.
Thank you.
Rami, I just forgot one word. We still have a big connection with England. A lot of our supporters are from England, and also the father of Mr. Shapiro. He was the one, he was a member of parliament, and he was very, very active. And I think the hospital without this has to be. So you see here, that's tradition. So the hospital tradition, the father of Mr. Shapiro was one of the founders and helped in the Sorry for that.
Very
I said
touching.
everything I have to know.
Thank you very much. Professor Sorkin, heading the intensive care unit.
Well, I was born in Paris, not so far away from London anyway. We had some problem with the English people, but we managed.
We can discuss later.
Yeah. Yeah, I was born and trained and studied and trained in France and also in the US. I was during quite a long period of time in charge of the intensive care unit in Tel Aviv, Ichilov Hospital, Solovsky Medical Center. And I left 1 year or something to help here. Where do you want to go?
He rides a motorbike.
Yes.
He rides a motorbike, which is more significant
I did
where he
find-
was born.
So,
How do you compare the quality of the intensive care unit in מעיני, Hiשועה and that of in
I can't compare
Solovsky?
because I was also in the Hichoil Hospital and also here. No, I have to say that as far as concerned many things, there is a huge difference between Solovsky Medical Center as far as concerned the intensive care and here. First of all, let's say all the apparatus that we get in the unit, by meaning ventilators, monitoring and so on, well, I think the best that we can have actually in Israel, which has helped us quite a lot concerning for the treatment and diagnosis of patients. Second is a team. The nurses and the nurse, in fact, they are very, very dedicated to the patient and also to the family. But we have some problems in the city hospital or government hospitals, as far as I remember. I think it helps us to manage and to treat the patient and the families. Because for us in the intensive care unit, we are dealing with a unit which concerns the patient first of all, the family, and the person on the treatment. We are working like a unit, and here we have a very, very, very good unit with family, nurse, doctors, and all for the patient.
Thank you.
Okay. May I please ask Dr. Sharon Eiser? Doctor? I understand that you are running the nursing department,
Yes, the head nurse of the hospital.
head nurse.
And I agree with what Professor Sorkin said, that the nurses here and the nurses and all the people that are sitting here are given treatment like they want to get and they want the family to get. And that's the place the people in מעיני הישועה are working from. And I think this is the special things here in מעיני הישועה. And all the nurses and everyone is really dedicated for the people, for the family. And we hear it also from the families.
And it starts from the top.
Devotion and dedication.
Right.
It's
That's what it is.
ongoing. Dr. Hannah Ophir, please. Dr. Ophir manages the
Try to speak. Working here is something different because you have to cope with different problems. For example, I have now a kid who was sent to us because somebody thought he has an eating problem. And now we've opened the specialty of eating problem. But when you looked at him, he's almost 15 years old, and he looks like an 8 years old boy. And we saw that he's very tiny. He's not only thin, he's tiny. And we looked at, we did some exam, and we found out that his bone age is about 8 years. And he saw his doctor for the last 5 years, every month, and nobody did any investigation why he's so short. So we did the preliminary investigation, and we found out he has shortage of growth hormone deficiency, and we should send him outside to do all the other investigation, because the investigation cost a lot of money to the hospital. But I thought on my own that if they will send him outside, nobody will do anything, because for 5 years nobody did. So there's no chance that and that's one point. Another thing, to take blood exam from this child, we had to sedate him because he was so terrified. We tried twice. First of all, we tried the regular doses, then the day afterwards, we tried the next dose. So I decided on my own that I will do all the dynamic tests in the hospital, although it will cost us a lot of money. And nobody, in no other place. No, nobody, in no other place would do it. We'll do it. And now we're doing the dynamic test. The first one we did right today. The second one we'll do tomorrow. And I hope we can give him growth hormone.
לא, אבל יש עוד רופא.
כן,
מהרופאים, מי שרוצה לדבר הרופאים.
לא, אני we already...
פרופסור בנק, מנהל הפעילות.
פרופסור בנק.
Yes, I'm a new acquisition, Glenn Bank, my name, for this hospital. I just arrived a month ago exactly.
And on your honor, he knew you were coming.
Yes, I also have another connection. I told you I hold a British passport as well. But anyway, I come from the major medical center. It's called the Sheba Medical Center. Very large, enormous hospital, very advanced technically, etc. Also from a medical department, and I also have a big interest in research. And one of the goals I have coming here, I hope these guys will support me, is setting up a research center for T-cell treatment of cancer. Called it gamma delta T cell, which I wanted to discover. Just came back from a meeting in King's College where they had the 8th International Gamma Delta T cell conference, headed by Professor Adrian Hayday, a leading immunologist in England. And I find the center actually very interesting. It's the atmosphere is different from a government hospital. It's actually quite dynamic. The patient population is a little different, but not all that different. We have less, because of some of the subspecialties absent from here, we don't see some of the things that are more prevalent in the internal medicines departments in large centers. But it's interesting, it's fascinating. Patient population is very appreciative. I find that one of the things that is striking, I think that the families are very, a lot of them, let's say not all, but many of them are very devoted to the patient, and it definitely influences how they come out of these difficult situations and go back to whatever status they were in before. So I think it's a very interesting medical center with a lot of potential. And it's a model, actually. I think it can be a model for similar kinds of things worldwide. Also, I'd like to point out that I don't know of any other center where the head of the hospital actually comes on the ward round to see what's going on with the patients, which is very unusual. It should be extended to all medical centers.
Thank you.
Thank you.
Now we will have the pleasure to hear the CEO of the hospital, the son of the founder, my second cousin, Mr. Shlomo Rothschild. Yes, he will speak in Hebrew and I will translate it.
כמו שראינו, לבית חולים יש ייחודיות גם באנשים המיוחדים שעובדים בו, גם בקהל שמקבל את השירותים, המטופלים. בית החולים זה גם קהל מאוד ייחודי.
As we have seen, this hospital is very unique, both in terms of the people who work for the hospital and also in terms of the patients who get treated. They're all very unique people, unique type of community and unique quality people who are here.
יש עוד הרבה דברים שמאוד מייחדים את בית החולים, אבל מה שאנחנו שמים דגש בתוכנית החומש, לבית החולים יש תוכנית חומש לחמש שנים הבאות שעשינו אותן ב-2015. את זה אנחנו עושים ביחד עם הדירקטוריון, ביחד עם ועדי הידידים בעולם, וככה אנחנו הולכים לפתח את בית החולים. הכיוון של פיתוח בית החולים, כל ההסתכלות של הפיתוח הוא בעיניים של הקהילה. בית חולים שלנו בעצם נקרא בית חולים קהילתי. זה הבסיס לכל המשך הפיתוח.
Okay, there are further unique features which distinguish this hospital from other hospitals, but we have a 5-yearly forward plan which we have finalized in 2015. This was a plan that was finalized and approved by the board of directors of the hospitals, also supported by the various country friends of the hospitals, the organizations in each country. And what I would like to stress that the core focus in this forward plan is to continue to operate as a community hospital.
מבחינתנו צורכי הקהילה הם, אנחנו משתדלים מאוד שבית החולים יסתכל עליו בצורה העסקית, בשביל שבית החולים יוכל להחזיק את עצמו באופן שוטף, אבל יש הרבה דברים שאנחנו עושים לקהילה, גם בגלל שהצרכים הגדולים, אנחנו מזהים את הצרכים הגדולים ויש לנו קשר עם כל הגורמים המפנים בקהילה, גם אם הם לא...
He says, whilst we are maintaining an economic principle of how to operate the hospital in simpler terms, not to generate financial deficits, we are aware of community needs which, judged on merit, they are loss-making, but because they cater for the community needs and we are a community hospital, we shall integrate such the services or operations in the hospital and still try to maintain the place balanced because we are a community hospital. So we are not economic in choosing which we will do and which we will not do.
בעצם הפעילות של בית החולים כמעט הכפילה את עצמה בפחות מ4 שנים האחרונות.
The volume of activity of the hospital has doubled itself in recent 4 years.
בין במספר השירותים שאנחנו נותנים, בין בבאג'ט, בין במספר המטופלים ש...
If you judge it in the number of patients, or if you judge it in the type of treatments you are doing it, and the volume of and the number of patients, the volume of the budget, and the menu of services. In every parameter, the hospital has doubled itself in the last 4 years.
זה קורה בגלל שאנחנו בעצם מסתכלים בעיניים של הקהילה, מה הקהילה צריכה.
This happens because increasingly the community recognizes that we are here to serve them, and therefore we are going with their needs.
חלק מזה זה הרופאים המאוד מיוחדים שיש לנו, כמו שפגשנו את חלקם ושמענו גם, שגם אם הם גמרו לעבוד, בגלל שיוצאים לפנסיה מוקדמת במדינת ישראל וגמרו לעבוד במקום אחר והם עדיין בשיא כוחם ושיא הפעילות שלהם, אנחנו קולטים אותם, וכך יש גם לקהילה יותר זמינות למומחים ברמת מומחים כל כך גדולה.
Certain medical experts in Israel have decided to take early retirement. We, knowing that we want to give the best, we will take such retired people on the basis that we recognize that they are still in their peak of their capacities, and we pick them because they are very, very good, and we want our type of patients to have access to leading experts that otherwise wouldn't have had it.
בקהילתיות יש שתי צורות הסתכלות. העבודה הפנימית שנעשית בבית חולים, שזה אומר המחלקות והפיתוחים שאנחנו עושים פה, והדברים שאנחנו יוצאים החוצה לקהילה. זה אומר דיאליזה זה דבר שאנחנו פתחנו בגלל שבן אדם שנמצא חצי מהזמן שלו, 3 ימים בשבוע מבלה בדיאליזה, שהוא מקבל את זה במקום ששם הוא מרגיש יותר באווירה שלו, זה משנה גם את רמת הטיפול, את מה שהוא מקבל, ולכן פתחנו דיאליזה.
איפה? פה?
פה. מצד שני, אנחנו גם יוצאים החוצה לקהילה, ועוד רגע אני אסביר גם מה הצד
החוצה. אז רק
תגיד
עוד מה אתה רוצה.
אנחנו לוקחים עכשיו פרויקט מאוד גדול למניעת סכרת בקהילה, שזה דבר שאנחנו רואים שיש בו...
He says that community work has got internal and external ramifications. For instance, the fact that he's decided to do here a dialysis unit is because people sometimes spend 3 days a week in a hospital. If they're in a community hospital, they spend it happier than if they're in a city or a government hospital. But community means also responsibility for the community. So he started to say, and he will soon continue, that they have launched now a very interesting program for prevention of diabetic diseases. Right. That is outside the hospital.
אנחנו בעצם הולכים לצאת לקהילה, התחלנו כבר את התהליך הזה, הולכים לצאת לקהילה לבדוק שאנשים ידעו בכלל את רמת הסכרת שלהם, שידעו את רמת שומנים בדם, שיהיו מודעים יותר לנושא הבריאות. הם יקבלו את כל הטיפול ואת כל המענה מכל הצדדים, שזה יכול להיות בהרבה כיוונים, גם בעיניים, גם בהרבה נפרולוגיה, הרבה תחומים שזה נוגע לסכרת. וטיפול מונע של פעילות גופנית, שגם זה דבר שאנחנו בונים ביחד עם הקהילה, בשביל לעשות את הקהילה יותר בריאה ומודעת לנושא בריאות.
Okay, so he says activities to make sure that everyone is aware that he needs to have sugar blood tests and all the liquids, you know, maybe some people have already eyes problems and they've been unaware of kidney nephrology problems, kidney problems or other problems that treat them. And in addition, he is now also launching another program to increase the health of the community, something around the bigger theme of physical exercises, physical activities.
אנחנו יכולים להאריך עוד הרבה זמן, אבל אם אני יורשה לי לנצל את ההזדמנות שהשגריר נמצא איתנו, אנחנו חושבים שיש לנו הרבה מה ללמוד, ואנגליה בכלל נמצאת ברמה רפואית יותר גבוהה מהרבה מדינות אחרות, כך שיכול להיות שנעשה איזשהו קשר עם בתי חולים באנגליה לשיתוף פעולה בנושא הרפואי.
He says he is clearly aware of the fact that this hospital has a lot to learn from British medical centers and that he contemplates reaching some cooperation agreement with some UK-based hospitals in order to enhance the situation here and to cooperate on and exchange know-how and knowledge which they have gathered here. Maybe that can be useful there, but mainly he wants to upgrade the situation here from British knowledge.
ואולי בנושא שאנחנו, בגלל שמדובר במלכה שחגגו יום הולדת מאוד, אנחנו הולכים לפתוח פה מחלקה גריאטרית בבניין שראינו פה מבחוץ, וזה בעצם מחלקה גריאטרית מאוד, יכול להיות שזה יהיה חלק מהכבוד למלכה כל כך מבוגרת ואקטיבית, שאנחנו נשתף את זה עם מחלקה גריאטרית הקיימת. מחלקה הגריאטרית הקיימת זה איזושהי הזדהות לכבודה על...
He wants, because the Queen has celebrated her 90th birthday, so the concept and awareness of geriatric is very important. He wants to dedicate one of his buildings, to name it after the name of the Queen. The building which is dealing with elderly people. He thinks this is solidarity with Britain.
אני באמת רוצה מאוד להודות, זה כבוד מאוד מאוד גדול שהגיע.
I would like to thank the ambassador very much that he took the time to visit us. We feel very honored and privileged to have the ambassador here with us. That's his work.
ויהיה לנו כבוד מאוד גדול לפני שנשמע את מילות הסיום לשמוע מהרב שפירא כמה מילים, תתרגם גם את זה.
He would like me to say a few words before the ambassador will speak mainly. So
Can I introduce you first?
לא, זה בסדר, זה בסדר. חבל שאבא לא נמצא פה. Can I say, shall I say it in Hebrew or in English? Which in English?
English.
Okay.
You understand
Okay.
their language? English, you understand?
I try.
Ladies and gentlemen, His Excellency the Ambassador of the United Kingdom to Israel, I must say that I'm trying to think what is the main message that I am trying to take out from this visit. What is the main message? I think that we have here two main messages. And as a businessman, I will start first of all with a commercial message. And the message is that it is really unbelievable how Dr. Rothschild, the father, has taken a most unbelievable abstract vision and turned it into such a great reality, which as we only just heard, from year to year, it gathers more and more momentum. It becomes such a powerful reality. So the message is never discount or never disregard any good idea just because it looks like a fantasy. A vision, a good vision should be pursued, and if you are dedicated to it, you can turn it into a real success story. And this is the example. No one would have believed that a town like Bnei Brak, which is not the biggest town and surrounded by such powerful centers like Tel HaShomer, Ichilov, Iher, Bellinson, which are famous not only in Israel but internationally very much reputed. So to make this here, this hospital, this is really an unbelievable story of to take almost a fantasy and making it a reality. The second thing is that we have here next a think to Laniado in Herzliya, in Netanya, where Rabbi Lieder was the CEO before. I think here an unbelievable example of a Jewish hospital which is following totally the spirit of the Torah. And the spirit of the Torah is to treat 90 years old men or ladies or 100 years as a boy of 9. The Torah does not distinguish in the value of life in accordance with age. Age is out of the question. So really this is a very, very unique place, and also as we heard, most of the cases which typically are abortion cases, abortions are not permitted by the rabbis, and most of the babies are surviving. So it is an unbelievable achievement for the Rothschild family to have put up a community hospital which the members of the community, chiefly religious people, can feel that they are in the place where they will be treated with devotion, passion, dedication, and strict compliance with the instructions of the Torah. And I am grateful to the ambassador for having asked me to come with him, because the hospital is in existence here for 25 years, as we have heard, and thus far I've not been privileged to visit it. So I would like to thank the ambassador for creating this opportunity, and I'm thanking you for my part to the team and to the management and to the British friends of the hospital for facilitating such a wonderful presentation and such a great tour through the hospital. Thank you very much.
Thank you.
Ambassador.
Well, thank you, and thank you, everybody. I'm very conscious how distinguished the cast list is around the table. I'm slightly worried about healthcare in Bnei Brak while you're all sitting here, so I feel that I've denied the talent of the hospital for this period. But it's a great honour for me to come and to meet you all and to see the hospital today. And thank you to Rav Shapira, my friend, for. It was a discussion evening at his house that led to this visit, so I'm very grateful for that. Sometimes, as a diplomat, it is very hard to get to know the country you are posted to. It is very easy to get to know offices in government buildings. It is much harder to get under the skin of a country and to see the bits that foreigners generally don't perhaps get to see and understand and develop a real feeling for. And that applies both in terms of different communities within a country and different institutions within the country. So I really feel that it is visits like this where I get to understand Israel a little more and to understand the sort of texture of the country in a way. And I thought it was a very inspiring visit today because we were talking earlier, a community hospital in the UK generally means something rather different. Something much smaller, something rather more basic perhaps, and something without anything like the range of extraordinary healthcare that you're providing today. So my conclusion from today's visit was that you have done an amazing job in combining the spirit of a community hospital with the medical care of a much larger institution. And that must be an extraordinarily difficult thing to achieve, to do those two things at the same time. Very few institutions, I think, probably manage that. And it is clear just from hearing everything that you've said today, how strongly that is driven by the spirit of the staff of the hospital and the leadership of the hospital, and how that ethos runs through everything that happens here in the hospital today. So it's really, I found it absolutely fascinating to see and very inspiring to hear about. And I'm delighted that there are such strong UK connections to the hospital as well. My guess is that there are things that this hospital might learn from the UK. I think there are probably many things that healthcare in the UK could probably learn from this hospital as well. And learning really works when it happens in both directions. So I would be delighted to explore whether there are ways that we can build even stronger connections than we currently have. But it's these really are fascinating visits for me, and I'm very conscious of the talent and the expertise around this table and how much time you've given up for this visit today. So thank you to everybody. I've learnt a lot from seeing it today. I hope it's not the only time I'll visit and meet you. And I hope it's the start of something more as well. But thank you really very much for myself for today.
Thank you. Pleasure.
And I apologise that I have to slip away in a few minutes because I'm seeing the Speaker of the Knesset this afternoon, and he runs to British time, I find. So
תודה. הייתי מבקש מחיים, תזמין בבקשה את הגברת רוז להעניק תשורה והיא כבר תסביר מה זה המתנה, ואחר כך את הרב לידר בבקשה לתת גם תשורה לרב שגריר. בסדר?
Okay, we'll let you go very shortly. Really, we're going to keep to our timing. Just before we do depart, say thank you. I'm going to say first of all that it's been our pleasure to host the ambassador. You should know that the ambassador has actually had some very senior positions before now, but I think he's enjoying this post. I can see it just from what he's talking about, and we also do hope that the collaboration between the UK and Israel through medical research and through collaboration between hospitals, which is something close to your heart, we can also be a major part in that progress. And because we have, as the chair of our UK board, as a doctor as well, who came in especially early for her vacation to be here for you, and you've met her during the course of the trip. So I'd like to ask Dr. Landau just a few words in preparation for a gift which we'd like you to accept on our behalf. Yes. We need a photo of this as well, so yes, please.
Okay, so Ambassador Quarry, first of all, thank you so much for giving up so much of your time. We really do appreciate it. As you can see, we could learn a lot in the NHS from these very, very dedicated professionals. These are definitely professionals with heart and soul. And as you've heard, what they have said, every minute of life is valuable. And that's something we really need to take as a real important lesson we need to take away with us. When I first came to the hospital, which is about a year ago, I just couldn't believe the love and the warmth and the affection, not only from the doctors, but from the patients, from the staff. It just seems to exude from the fabric of the building, and it's something that I feel every time I come, and we hope to welcome you here many, many more times. We have something very special for you. These are actually implements from the past, from the these are bronze surgical instruments which are genuine antique and made between the 1st and 3rd centuries CE in the Roman period, which is presented to you. We welcome you on the 2nd of August today. So we have moved a little bit away from this to what you have seen today, and we hope we can progress more in the future, and as much interaction as we can have between here and between the UK, I think will only be valuable for all of us.
Thank you very much.
So much.
Thank you. That's better. Thank you.
רגע, אני הייתי רוצה להזמין אתם תישארו פה, תתרגם אותי. הרב לידר, בבקשה, מתנה לרב שפירא, ואחרי זה נעשה תמונה משותפת.
While he is coming, I do want to say that Rav Shapira has actually been awarded recently the Officer of the Most Excellent Order of the British Empire, one of the UK's highest government honours given to civilians and non-British citizens for strengthening the ties between the UK and the Haredi community, and it's a great honour for Rav Shapira to be part of our team. Thank you so much for coming. Okay.
Okay. קלף מיוחד שחיים קניאבסקי חתם עליו, לאלה שעוזרים לבית החולים.
עבודת יד מיוחדת.
זה כתב ידו?
זה כתב ידו של חיים עם תרגום פה.
This is a handwritten blessing to Rav Shapira from one of the leaders of the community here, and this has been presented now to Rav Shapira.
אני אקריא את זה בקול ברשותכם.
Okay.
הנה בית הרפואה מעיני הישועה כאן בבני ברק, פועלת גדולות ונצורות כבר 25 שנה, וכעת, אני מקווה שאני לא מפריע לאף אחד, וכעת הרחיבה פעולותיה והוספת בניינים חדשים, וזה ממש הצלת נפשות. לכל העוזרים ומסייעים בזה יזכו לסייעתא דשמיא בעסקיהם, ואריכות ימים ושנים טובות, והקרן קיימת לעולם הבא. מקום החותם.
He writes a blessing saying that anybody who is involved in the continued development should be blessed also with long life and health. So that includes you.
חיים, בואו תצטרף לתמונה. הייתי רוצה להזמין, במקום שאני אצטרך לעמוד פה, להצטלם את הרופאים בבקשה לתמונה משותפת עם השגריר.
And the other 12 professors send their best. אוקיי, חבר'ה, אוקיי.
אם אני אוכל להטריח את האנשים המכובדים לרדת לקומה 0, אנחנו נלווה את השגריר החוצה ונעשה ליד התמונה הגדולה עוד תמונה משותפת. תודה רבה לכל אחד ואחד.
קדימה. אוקיי. קדימה, האוטובוס יוצא.
Thank you.
פרופסור, שבודרי ומסית רבוקו. faire votre connaissance. אבל אני מכיר
That's why in Israel.
I've met you before, right? You've been here, yeah.
Out of hell. We don't have to use it, but that's